what are the risks of overdiagnosis as we get to these cancers sooner?
The risks are that sometimes if we are dealing with these indolent tumors that may not even have a significant impact on your mortality, then we are risking the potential toxicities and downsides of treating these early indolent tumors that may not even need to be treated at that point or may not ever need treatment. And so, prostate cancer is an example of this, where, many patients are diagnosed initially with what we call a low risk or indolent prostate cancer that may be amenable to active surveillance. But some of them aren't. It's not easy to determine which one has a more aggressive prostate cancer, which one doesn't. And so we don't want to undertreat the more aggressive prostate cancer, and we don't want to overtreat the indolent prostate cancer. And we have currently decent guidelines or parameters to determine that, but still not exactly perfect. And so we need to be able to really specifically and personalize and characterize that specific patient's cancer and understanding whether it is, indolent, aggressive, or moderate, and justifying treatment rather than using this generalized categories or a general non-specific parameters to identify and classify someone's tumor. And again, like I said, we're really trying to get down to personalizing your care.
Do you see overdiagnosis in any particular cancer more often than others?
Right now, I think the diagnosis related to breast cancer, where we're finding a lot more early stage breast cancers, such as what we used to call ductal carcinoma in situ, stage 0. There is controversy now of whether this warrants even treatment, and so that's a controversy. I personally vouch that it's justified and allows us to have a 100% survival rate like stage 0 does. So, there will always be these debates when we talk, because it becomes a public health issue about the overdiagnosis. But as a cancer doctor specifically treating cancer patients, I don't believe that we are overdiagnosing patients.
Are there any home screening techniques or devices available for people that they can screen themselves?
No. At this point in time, there is really nothing that can do that. It probably can only cause more anxiety. With women, they did a study with self-breast exams, and they didn't even that hasn't really shown improved outcome. And so sometimes it can actually lead to increased anxiety. So it's not necessarily saying that it's recommended or not recommended, but I think that's sort of an individual choice. But at this point in time, someone that would want to seek medical care should go to the medical professionals, and they let them handle it. Yeah.
And when you say medical professionals, you mean Dr. Google, right?
Exactly.
Would it be helpful if there were consumer products or personal products where people could monitor their health more?
Possibly. It's just that you don't want to. But it could also be potentially harmful if they're going to take their health in their own hands when and overstep their bounds. I think it really needs to be a careful balance of knowing when to seek professional attention. Obviously, no one is better than taking care of yourself than yourself in terms of your own health. But at the same time, there's a valuable role for, health professionals to help you with your health. So I don't think that these new tools may replace seeking professional care, but maybe it could assist the professionals with their care because we're not with them every day, right? We're not there 24/7. So these tools, these home tools or diagnostics could potentially be helpful for the medical profession to have a better assessment of their patients, even when they're not in their exam room.
With COVID, we've seen a dramatic decrease in cancer diagnosis. Does this trend concern you?
It's very concerning. We are predicting a huge outbreak of patients with advanced cancers coming in the next few years. We are very concerned. I mean, we've already seen this, when prostate cancer patients were, or patients that were eligible for prostate cancer screening were not screened due to the guidelines not recommending screening. That was, in the early, late 2000s, early 2010. During that period, there was a significant advancement, growth of patients with advanced prostate cancer, which actually led to the changing of the recommendations, then sort of highlighting or at least advocating consideration of screening. And so here now with patients not going to screening for breast cancer, prostate cancer, colon cancer, we're worried that there will be a significant outbreak, even lung cancer, because the low-dose CT screening has made a significant advancement in identification of early lung cancers. So even patients that present with symptoms or mild symptoms that don't want to go to the doctor right now due to COVID, that also is going to lead to advanced cancers, not only due to neglect of not getting their screening test done. It's also just being neglecting their symptoms due to their fear of COVID. And so we are trying to prepare for ourselves for that and anticipate this coming in the next few years with a huge increase of patients with advanced cancers. And that's going to be very unfortunate because, as we said, the outcomes are just so much better when they're identified earlier.
Well, it's very exciting to be looking at some of these innovations and being able to share them with our community, because to me, as a cancer patient, it's reassuring to know that there is stuff going on that hopefully will benefit not only us as survivors, but I'm especially concerned for my kids. So it's very exciting to look at some of this stuff. So what last piece of advice would you like to leave our listeners with?
The last piece of advice, like I said, is what we talked about before here is that since 90% of cancers are environmentally induced, it pays to live healthy.
Again, I want to thank you for being here and sharing your information with us. We always appreciate talking with you.
Thanks a lot, Ann.
Thank you for watching the Lowdown on Cancer presented by the Cancer Fund. To learn more about what's coming in future episodes, visit us at www.cancerfund.com. While you're there, check out past episodes and be sure to click Join Us to become a member of the Cancer Fund community. As a member of the community, you'll receive early access to new interviews as well as other announcements. Make sure to connect to all of our social media channels so you don't miss a thing. In addition to getting early access to new episodes of the Lowdown on Cancer, Cancer Fund members play a critical role in driving cancer innovation forward so that one day we can more than hope. We can actually beat cancer. Thank you for joining us on this journey.